Hello folks, welcome to Legacy IIS Academy. In this video, we will be discussing a current affair topic presented to you by your faculty, Sushma KP. So what is the topic that we will be looking into today? How nanorobots or your nanobots can transform cancer treatment. Now first and foremost, why is this particular topic in news? Dr. Ambarish Ghosh, who is a professor at IISc Bangalore, has come up with a breakthrough innovation. What is this innovation means? He has developed magnetic nanorobots which will be used for targeted cancer therapy. What is this targeted cancer therapy? We will be looking into the course of the video. And he has also been awarded 2025 New York Academy of Sciences Transformations Prize for his contributions in the field. Now, first and foremost, let's speak about cancer treatment. See, cancer treatment pe lot of studies has been made, lot of treatments has been brought up, yet nothing final or conclusive has been come to. But one thing this particular study is looking is they are trying to see the limitations in the current model. What are the limitations in the current cancer treatment? First and foremost, chemotherapy which affects healthy cells, which means if you are going to target the cancer cells, then that particular vaccine is not just affecting the cancer or tumor cells but also the healthy cells. Understanding, which creates difficulty for the healthy cells and regeneration, all those issues, which will lead to what? A long recovery time. First thing. Second thing, if it is a deep tumor in the cells or tissues, it is becoming even more difficult to reach the target. And at the same point of time, because of this, there is considerably larger amount of side effects and it is also a very costly process. These are all the issues. So what do we want from the issues? That is, what do we want as a treatment that avoids these things? We need a targeted, precise, minimally invasive and cost-effective treatment. Now, the video about your nanorobots is one such solution. If you're someone who is interested in knowing your local, national, international news, then subscribe to Legacy IIS Academy channel. We provide deep insights into these topics. Now coming into this, what are these nanobots or nanorobots? See, as the name tells, nano, which means a small, very small, which is 1 to 100 nanometers. Understanding? Now, to see how this works, look at this image. Do you see the small helix kind of structure? Yes, this particular one, this grey color thing, this is a helix. Otherwise, a helix-shaped nanobot or nanorobot, which when injected, it will travel through blood, it will travel through tissues, it can even travel through cells. What does it do? It goes and it gets adhered to a cancer-secreted matrix or tumor cell or a cancerous cell. It will move past your healthy cells, otherwise non-cancerous cells. So, it is going and attaching itself to a cancerous cell, leaving the non-cancerous cell. Okay, now we have seen that a nanobot has gone and attached itself to a cancerous cell. What will happen from now on? First and foremost, if you see the movement of this, it is inspired by a bacterial movement, same like a corkscrew motion or a helix-shaped tail. How are they moving means that is because of a magnet attached to it. The magnet is made up of iron. Okay. The external magnetic field, using that you can control the movement of this. Also, this enables precision targeting as to where you have to, if it's a deep tissue. Understanding? Now, what is the body? I told you the magnet is made up of iron. The body is made up of silica. Okay, this is what majority is seen in other nano medicines also. And the ion tip, again for the magnetic control, both are already used in the medicines. Now in the tip or the surface, they are coating the anti-cancer vaccine or the medicine. Look at this. So when these go into, okay, let's say this tumor, they go into, okay, like a drilling motion. When they have to enter in, if you have to drill, you know how it mimics the drilling? That's exactly how it comes inside. Understanding? So the magnetic micro robots mimic bacterial flagellum, that is same like a bacterial movement, that is what we spoke. And through this magnetic field rotation, again which is externally done, it replicates that movement and enters into this. Okay, fine, we have now seen what are they made up of, how do they go in, how do they attach to cancerous cells, how do they attack these cancer cells. This is where we see targeted drug delivery. First thing is the drug is coated either on the surface or on the tip of this nanobot. It reaches only cancerous tissues and it avoids healthy cells. Now what was the first thing when we started the video we discussed? We need something that is targeted, precise. That is what this is operating on. Now, okay, it has gone. What does it do? Nanorobot or nanobot generates heat greater than 42 degrees Celsius, which will destroy the cancerous cell, which will spare the living healthy cell. Understanding? This is where the side effects also reduce. And one of the main important thing about your nanobot is it itself can act as a therapeutic agent, which helps in recovery process. And also when an oncologist is doing for, let's say, a scan or an MRI, nanobots can act as MRI beacons, which means they can light up and showcase, okay, these are all the regions where we have found the cancerous cells or tissues. So this will help them locate deep tumors and also track movement of these in the real time, whether they are benign or not. So what is this particular nanobots useful for? They are useful for diagnosis, surgery and also targeted therapies. So far what has it been used on? For example, in breast cancer, ovarian cancer, okay, the tumors will become invisible almost to scan. So you can apply it for these. Beyond cancer, if you see where is it applicable? In your root canal treatment. In your root canal treatment, largely it is being targeted by your Fishless bacteria, wherein in order to deal with that, first you spray the entire area with your sodium hypochlorite. What happens when you spray sodium hypochlorite? If it penetrates deeper, it will create a lot of pain and swelling for days. But if you use these nanobots in your root canal treatment, it will be pain-free and 100% effectiveness has been seen in your animal trials, and it does not damage the soft tissues like your sodium hypochlorite. When you spray, it creates pain and swelling. So that is reduced. And alongside this nanobots in your root canal treatment will help in tooth mineralization and dental tissue regeneration. Now what stage is it on? It is tested on cell structures and also on your animal experiments. Still clinical trials are ongoing. But what they have got as of now means they have filed for multiple US patents, and also they have seen that the cost of this, remember in the very starting I told you it has to be cost effective. Here whatever procedures they've used, it is the normal terminology and technology of your nanofield science, nothing new. So which makes it not a specific need of very costly expensive MRI grade magnets. It just uses simple electromagnets. So what is now needed in this stage means regulatory approval and market acceptance. They've seen that yes, they have good amount of market and patents available in US, so they are waiting to start it as their own startup. And also this particular aspect, if we would use in ours, So it could be like in Atmanirbhar of more of your academic and industrial linkage. With this, we come to the end of the content. If you like our content, subscribe to our channel, hit the like button and share it along with your friends. Thank you.